Is new video of Dodger Stadium that we shot this morning. It looks unusual because normally the place is packed with cars with people waiting in long lines to get tested for coronavirus, but it's empty today since the site is closed. It's going to be closed tomorrow and closed Saturday as well. Clinical nurse and NBC contributor Alice Benjamin has been providing context all throughout this pandemic for us, and she joins us live right now, and we are so very grateful to see you again. Thank you, Nurse Alice.
Thank you for having me.
And Nurse Alice, we showed you the Dodger Stadium is closed today and tomorrow, like many sites, because of the holiday. But what happens if someone finds out they have been exposed? What should they do?
So if you believe you've been exposed to someone who's had coronavirus, you definitely need to quarantine yourself. And what that means is you need to make sure that you're taking all of the precautions, limiting your exposure, not going out until you've gone through that 14-day period to make sure that you've not developed signs or symptoms or you've not been tested positive, because people can transmit the virus asymptomatically and immediately after that exposure. So we try to limit that by asking you to please quarantine.
Let's talk about those symptoms, Nurse Alice, and also explain if we're going to see any different symptoms with this new strain of a coronavirus that has gone from the UK to Colorado and is now in Southern California.
So I think it's important for people to understand that 1 out of every 5 people will be asymptomatic when it comes to coronavirus. And when we're looking at symptoms, we're looking at shortness of breath, cough, fever, loss of smell or taste. Sometimes it can present as GI symptoms. You can have a fever, maybe not, or so. But, you know, it's very vague. It can feel like a flu or a cold. But nevertheless, if you are someone who are having any of these type of symptoms or believe you've gone out in places where you could have been exposed to someone and believe there might be some relation, we're going to ask that you please quarantine so you don't spread these things to other people. I know the testing sites are closed. People are going to feel these symptoms and want to come to the emergency room, but we're going to ask that you stay home and treat yourself, because the ER around this time of year is going to be inundated with other injuries and common things that happen this time of year. Because people are at home, some are depressed, they might be, away from family and friends, they may be more likely to drink. And unfortunately, that means that we might see more alcohol intoxication. We might see more people getting behind a wheel and driving, leading to car accidents. We have more people who have falls, trips, and things like that, where, they might bruise or break a leg. And then as well, people are going to be using fireworks. And there are always firework injuries. We get really concerned with burns, eye injuries, body injuries because of use of fireworks and the improper use of fireworks. So I want to make sure that everyone's safe and do everything you can to keep yourself and your family safe and hopefully stay out of the emergency rooms, because although they are very needed and we welcome you when you're ill, if you can prevent any type of injury or illness, we'd rather not see you in the emergency room.
Absolutely. And that list of possible symptoms for COVID-19 runs the gamut. But what are the more severe symptoms that we should look for that you really need to watch out for, and the ones that might cause you to go seek help at an emergency room?
That's actually a great question, because we do have some people say try their best to treat at home. But if you're someone who's, very short of breath, you can barely, get across your bedroom, you can't do your normal activities, you're very winded, you're weak, extreme pain, you're vomiting or have diarrhea, can't keep any fluids down, we definitely want you to come into the emergency rooms, because while some people can treat at home, if your symptoms get severely ill, we definitely need to supplement. We may need to give you IV fluids. Your shortness of breath and your cough might have led to something bacterial. We might need to give you antibiotics. So if you're just in extreme misery, so much pain, you can't breathe, you're just having a hard time keeping food down, liquids down, we want you to come to the emergency room, because we don't expect for you to have all the tools and the treatment that at home that we can provide you. So yes, stay at home and treat, but once the pendulum swings and you're really like, I don't know that I can do this myself anymore, that is the time to come to the emergency room.
Nurse Alice Benjamin, thank you again so much for joining us. Wishing you a very happy New Year's Eve. And I don't even have to ask. I know that you are following your own best advice and staying home.
Yes, I am. You guys have a happy, healthy, and safe New Year's.
Thank you so much.
We'll see you next year.
See you next year.